And today I am joined by the amazing Dr. Yasmin Carter. We are here with Complete Anatomy by Elsevier to talk all things reproductive health, to speak about their new male pelvis, which has been updated on the platform. And we are so excited to be here with every single one of you for this very interesting discussion that we're going to have. And so, yeah, we're just going to get kickstarted into it. So, my name is Aghogho Okpara. I am currently a third year medical student at University College Dublin, and I have a bachelor's degree in biomedical health and life sciences. So I'm very, very passionate about health, about education, and about representation in general. So I've actually done a few research projects over the years that has allowed me to, put my foot into a few different things. My most recent research project was on Burkitt's lymphoma, which is a childhood cancer that essentially affects people predominantly of the African race. And as a result of my research in this cancer, I won a gold medal for this. So I'm very, very passionate about all things oncology and all things pediatric research and representation research in general. So, alongside this, I'm also a content creator. I do education and wellness content online, and I have an audience of over 300,000 people across TikTok, Instagram, and YouTube. So, that's what I do for fun. And alongside these things, I'm also a writer, a public speaker, and I have been nationally recognized in Ireland here as a young leader. So I'm very excited to be here today to speak about the things that I'm already very, very passionate about. And I'm so excited to be joined by the amazing Dr. Carter. So I'll hand it over to you to introduce yourself, Dr. Carter.
Hello, lovely to be here and to be talking to you all. So, I'm Dr. Yasmin Carter. I use she, they pronouns, and I am Associate Dean for Academic Programs at the Mass College of Pharmacy and Health Sciences School of Optometry, as well as an adjunct professor at UMass Chan Medical School. So, that means I teach anatomical learners of pretty much all levels. And my area of expertise is essentially sex and gender medicine. So, I'm very interested in the pelvis and reproductive health and also education. How do we work around a lot of the taboos and lack of experience that we have in this area? And I was also the subject matter expert for the Complete Anatomy female pelvis and now the male pelvis. So I'm just so excited for people to be able to see how those are going to really help them understand and learn at every level.
Amazing. Well, I'm so happy to be joined by such an expert in this field. And yeah, I guess we can kickstart off our discussion. Yasmin, I'll hand the floor back to you to go ahead and speak about whatever you want to.
Absolutely. So, one of my biggest things as a medical educator is really working in areas. I joke with my students that anatomy is the only subject you have where you have a cheat sheet. But we run into a bit of an area that is more difficult for us, and that's the pelvis. And the pelvis is difficult to learn anatomically for a number of reasons. Number one, it's a very small area, and we fit a heck of a lot in there, and it does tend to cross regions, whether we're talking about the pelvis or whether we're talking about external genitalia. So that can be really difficult to understand. And then honestly, we run into this kind of really fascinating subject of medical education, which is experience. So about half of all medical students are female and half are male. Sometimes those numbers shift depending on the country. But that means about half of the people in the room learning about this topic have no real lived experience with this anatomy. And we don't realize how much we rely on lived experience to give us our foundational knowledge of something. And so, people are really reliant then on hitting the textbooks and really trying to understand these areas. And the problem there is, and don't get me wrong, I love a good textbook. I'm old school, but two-dimensional pictures are really hard to understand when we're talking about something so three-dimensional, especially in the pelvis. When we look at the male pelvis, we have a lot of very midline structures that we might be interested in. So the urethra, the penis, the prostate, the bladder. And then we throw in a bunch of paired structures with testes and ductus deferens and seminal glands. And how do you represent that accurately in two dimensions so that learners can understand it? And I think one of the big problems that I see is that two-dimensional images are created by people who already know. And so they kind of have this inherent floor of like, well, if you know what you're looking at, these images make perfect sense. But, it really is so dependent on, again, that foundational knowledge. And so by being able to work in 3 dimensions, which is what this new pelvis model has brought to people, is it really gives them the opportunity to travel, to move through the region, to see it differently, to be more interactive. We know that a lot of medical education, and that's true whether we're talking, medicine, whether we're talking PT, whether we're talking optometry, whatever your field is, there's less and less time in the lab, in the classroom. So a lot of our understanding, our education is self-directed. And so anything we can do to be more interesting, make sure it's accurate, and have fun, we're going to learn so much better. And so for me, being able to kind of show my students, okay, here are these structures. Let's follow them. Let's think about where they're going. Let's think about the relationships. What happens when? For me, that's just like the coolest part of being able to work in 3 dimensions. It's accurate, but honestly, it fits so much better with the work that we do as medical educators and the work that you do as learners. It's going to make those shortcuts for you. It's going to make it all so much easier.
Absolutely. I completely agree with you, Dr. Carter. I feel like as a medical student myself, and as somebody who generally does not learn anatomy very well by words in a textbook, I
So
completely agree with you. Like, I think that 3D anatomy is a game changer for students all over the world. It definitely was for me. I still remember the first time I learned anatomy when I was in my bachelor's of biomedical health and life sciences, and I was coming out of secondary school slash high school, and we had been taught about, very, very surface level anatomy, like, oh, this is the humerus, this is your femur, etc. But we were never, taught to focus on the little details, or we were never even taught anatomy in a more just three-dimensional aspect of things, like the way structures are positioned, the way to look at things, from different angles, from different cross sections. And I found then that when I got into my first year of my undergraduate degree, I really, really struggled with anatomy. I had the most amazing professor. He is incredible, and he was so good at engaging me in this subject. However, my biggest struggle was that I could not wrap my head around being taught a 3D thing in a 2D format. And I remember coming up to my exams, like what I was trying to do is essentially, take extra measures to be able to make sure that I was going to pass my anatomy exams with this struggle in mind. And what I would do is I would go out of my way to literally find videos online that would help me better visualize structures. And now that I'm studying medicine and I've gone past that degree, I remember when I first came across complete anatomy because my classmates were actually talking about it. And I was like, what's that? And one of my classmates was telling me how it's the main way that she uses to study anatomy, because she can see the entire structure and she doesn't even use a textbook anymore. And the lecture slides are almost like an adjunct to what she's already seeing on complete anatomy. And because of that, I decided to try it myself. And that's when I really saw that as somebody who definitely identifies as a visual learner, this was like unmatched in terms of improving my anatomy education. And I just think that, like you said, in the real world, this is essentially what we're going to see. We're not going to see, you're not going to walk into an operating theater and see a 2D pelvis in an actual patient, you understand? And so I think that it's such an amazing tool, and it's so, as a current student, it is so, so, so impactful in my learning. So I completely agree with all of your
And
points.
I think that's so interesting what you're saying there too, because it actually fits with something that somebody's saying in the chat about
Mhm.
anatomical donors and how much better that is. And I'm an anatomist first and foremost. I will completely agree with you that people who
Yes.
donate their body to anatomical programs, the variation we get to see, the 3 dimensionality, especially if you're able to get in there and prosect yourself. The problem comes in that a lot of schools don't have donation programs or are unable to use anatomical donors. And so, this is a really great supplement for schools that are not able to do that. But even for schools where students have access to donors, it might not be 24/7. And it's not going to be for their entire 4 years of medical school. And so for me, I'm like, this is great. So, like at UMass Chan Medical School, we have a full sort of top to toe dissection of anatomical donors, and that is just an incredible foundation. But then, say 3 years later, you're rolling into your gynae residency, or you're headed into a surgical rotation, and you want to prepare yourself again. You want to update your knowledge. I'd love to think that they're going to go back to my lecture slides. I am knowledgeable enough to know that's not going to happen. And that's okay. But this is such a great tool then for them to come back and really be able to use that, especially if there's like slides that I made that where I was able to say like, hey, here's the prostate and here are the lobes, and this is what we're going to be looking for clinically. Being able to take that 5 minutes on your phone to touch base again, I think is tremendous.
I absolutely agree with you. As somebody who's currently on my surgical rotations, you're literally describing the way that I revise content
I
before going into the operating theater. So, like for example, right now I am rotating through ears, nose and throat, so ENT, but next week I will be doing my urology rotation, and I will literally be using complete anatomy to refresh
time.
my knowledge. Do you know what I mean? And I
Yeah.
did have an incredible lecturer, and I have amazing. I can never fault my anatomy professors because they've been so incredible, in my learning experience in medical school. However, when you are short on time, you're studying for separate exams, but you also want to not enter an operating theater and not know what's going on. You kind of like something that you can quickly pull out. And that's the great thing about complete anatomy. Like, it's not only on your laptop, you can also access it on your iPad. And so even when I'm on the go, if I want to quickly revise something in 5 minutes, I can just open up the app versus my lecture slides where I have maybe hundreds of lecture slides downloaded on my iPad.
Guilty.
You know
I
what
do
I
that.
mean? And it's a
Sorry.
bit more difficult to scroll through those slides and find out the exact piece of information that you need in a given time. So I think it's such a practical tool. And as somebody who I don't really like, being in the hospital and having the privilege to speak to patients and even to see them being operated on, I don't like entering into those spaces with no knowledge whatsoever. I think it's so important to, for me to be able to take full advantage of the learning opportunity that I have and other students have. It's so important that we're able to revise things in a way that is as close as possible to the real form itself.
Yeah, absolutely, absolutely. And you raise such an interesting point there too, because we talk about patients, and really that's the whole point of medical education, is to allow us to make that connection to our patients, to understand their anatomy, so that unfortunately when things are going wrong, we're able to really communicate with them. And so for me, one of the things that I'm most fascinated about this area, both in the female body and in the male body, is a lot of the sort of cultural taboos that we have. And we hear that word cultural taboos, and we sort of think about, oh, cultures other than our own. But it's
Yeah.
really a lot of like how we grew up. We
Hmm.
didn't necessarily grow up talking about penises and vaginas and having like very straight up discussions about your ability to pee at nighttime. But if we want to build trust with patients, and we want our patients to be able to speak to us honestly and feel comfortable and overcome some fairly large historical mistrust, then we have to have two things. We have to have knowledge. We
Hmm.
have to have a really good knowledge of this area, but we also have to have the language. We have to have modeled again and again and again the ability to talk about this area, to be honest and open and frank, and really encourage conversation with our patients, because anatomy isn't just on the page, it is page to patient, right? We have to get that knowledge out in a way that is going to be supportive. And so I think a lot of this, even what we're doing right now, this ability to have those conversations about the pelvis and recognizing that, honestly, this is an area your patients really, really, really care about, like really care about.
Hmm.
And at the same time, it's probably the area they're least comfortable telling you as a clinician about. And it's funny because for myself, I teach at so many different levels, and so people will say like, okay, medicine, that makes perfect sense, they've got to learn, but why does an optometrist or an occupational therapist need to understand the pelvis? And it's really getting into like, patients need to be able to tell you things. We need to understand what's going on with the pharmacology and the impact and the side effects. And so there's a lot of different levels to understanding this. And everything we can do to kind of work through those taboos in our educational time means we're not then having to find that space and find that conversation with our patients in the future and find that footing.
Yeah, no, I completely agree with you. I think that patient trust is such an important thing to build. And not only that, but even our own confidence as healthcare professionals and as those who are involved within the medical sphere. It's so important that we're able to talk about things like this. I mean, I think it's actually very timely that we're having this discussion in November, a month where we try and raise awareness about men's health, about things like prostate cancer, testicular cancer, and even men's mental health in general, because these are things that generally people tend to shy away from those conversations. I've had conversations with people in the past that have told me that, they had an issue with either their pelvic area or their other sexual organs, and they felt afraid to go to a doctor about it because of, a sense of shame or a sense of embarrassment. And these things, like these senses of shame or embarrassment connected to your health, can actually end up being dangerous in the future, because if you leave a situation or a problem like that alone over a long time, it only makes the problem get worse. You know what I mean? Like, I've spoken to people that have said
Mm-hmm.
when they finally did go to their doctor was like, why didn't you come to us sooner? You know what I mean?
Mm-hmm.
And I think
Yep.
I think that's why it's so important that we emphasize and teach these things well at the stage of, education, before people are released into the workforce and before people are released into being able to now interact with patients. Because if we get the new generation of doctors comfortable with these things, perhaps then when they meet their patients, it won't be this, hidden subject that we dodge. It won't be this elephant in the room
Mm-hmm.
that is essentially, I mean, at the end of the day, your reproductive organs affect your entire body's health.
100%.
And if we ignore them, then it's not helping us as healthcare professionals, and it's definitely not helping the patient. So I think it's so important that we do talk about these things and remove the stigma attached to them.
Absolutely. And it's really interesting you say that, because I was just reading on testicular cancer. And so, testicular cancer is a fairly easy to identify cancer. It is actually the 20th most common cancer worldwide. There was about 75,000 cases last year. But weirdly, the incidence is going up, and we don't know why. And one of the reasons that is sort of being put forward is that it's being identified a little bit later. And part of that is because people aren't doing self checks like they used to. There was a time kind of about a decade ago where we were really good. We were teaching people about how to do a testicular check, how to feel for the epididymis, how to feel for lumps and bumps.
Mhm.
And we sort of kind of fell out of that a little bit as that conversation again became awkward. And maybe we didn't want to have, a male patient maybe didn't want to have that conversation with a female clinician. And so it's really, for me, it's fascinating that we're seeing these impacts in the clinic of these discussions. Um, yeah, it's interesting.
Yeah, no, it absolutely is. That's very interesting that the incident is going up, and I'd be very curious to see research like that discovers or that delves into that deeper to understand really like the reasons why. Is it because of a lack of conversation? Is it because of people, not feeling comfortable in that sphere? You know what I mean? Like
Yeah.
talking about it. Because I mean, even something like prostate cancer is something that is more common in Black males
Mhm.
particularly,
Yeah.
and this can be a problem, because already, I mean, I'm not in the United States myself, but I already know that in the United States, African Americans have a sense of distrust generally. I mean, research has shown they have a sense of distrust with the healthcare system. And I mean, this is why conversations like this are so important. And this is honestly why I think that educating the next generation of healthcare professionals on matters like this is so important. And I love the fact that even in Complete Anatomy's update of the male pelvis, they have included different models of, showing different skin colors, for example. And I mean, as somebody who is of the Black race myself, I know the difference it makes when I'm taught something from a point of view of, oh, this is somebody that looks like you, right? Because I mean, I've been in situations before where we're taught about something, and the only pictures we're being shown is a person of the Caucasian race. And
Hmm.
this concerns me at times, because I'm like, what's going to happen in the future when my fellow colleagues encounter somebody who's, whether they're Black or Asian or of the Middle East or something, and they're like, I don't recognize this presentation because of, I don't know, maybe the skin is not as prone to being red as a fairer skin complexion, right? And I
Yeah.
think that people think that it's only when you get out into the healthcare field itself, like when you're in the hospitals, that you then learn, but it's actually becoming familiar from the classroom that allows you to then be comfortable when it comes to practicing on actual patients. It allows you to be comfortable when you then go in and you see a patient, and it's like, oh, I recognize this. I mean, in my anatomy learning resource that I was using, I've seen something similar to this before, and therefore now I feel more apt to be able to, whether to examine this region. I feel, it's just a sense of familiarity, I feel, that builds confidence. I don't know what you think of that
I
also.
I 100% agree, and I think one of the interesting things is that medical education can have a tendency to pathologize dark skin. And
Mm,
so for the skin of people of color, a lot of the time we'll say, "Oh, okay, well, like for example, bed sores are more common in darker skin because they're left for longer because we're not great at identifying bed sores on dark skin." And so then educators are like, "Okay, I'm going to show you a bunch of pictures of darker skin with developing bed sores." And I'm like, that's awesome. But it's also slightly pathologizing. It's really saying, like, oh, well, we only care about this when it's going wrong. And so one of the things that I think is really kind of interesting for me, what I've tried to do is when I'm creating images or I'm picking out images to use or I'm making slides on screens in Complete Anatomy, is I will put a dark skin specifically for my normal, because
mm,
mentally I'm creating this link that this is normal anatomy, this is what we're expecting to see. And so when I get to a patient, it's not feeling like, oh, I should be looking for a pathology or I'm looking for something different because there's a problem here. It's really just normalizing, the irony being normal anatomy. And so I really love, as an educator, those opportunities, because it's really like double dipping.
mm,
Because how do you go and really you have so little time as a student in the classroom, in the lab with the donors. How do we get more out of that moment? How do we get more teaching moments out of that moment? And some of the conversations I've heard from my learners around this, when we've been able to incorporate skin of color as the normal. We also do this for weight. I have pictures of, like, here's a healthy individual and I'll have a larger individual.
mm,
We try to do it for so many different things, height, but really being able to do that for people of color, I think, has a massive impact long term in creating a generation of clinicians and physicians who are just accepting of normal, and that normal has this immense variation. So I think
mm.
it's a wonderful opportunity to learn, but also prompt conversation.
I completely agree with that. That's amazing. I actually haven't really thought about the fact of, pathologizing versus showing normal, and that's something I'm definitely going to think about more later on this evening, because it's absolutely right. We need to normalize things that are normal. Like, we need to normalize things that are normal in our education. So yeah, I think those are amazing points, yeah, Yasmin. So I think a question I'd have to ask you is, from your experience of using Complete Anatomy, what would you say is like your favorite feature, I suppose, that you have come across?
So for me, it's being able to make like cross sections, cuts, being able to pull out specific screens. So the prostate is a really great example of this, because the
Mm,
prostate has anatomical lobes, which is really, anatomy was great. At one point, sometime in like the 1600s, we just looked at things and we were like, ah, yes, I can see some shapes there, and I'll call it a lobe. We do that in the liver, where we're like, here are the four lobes of the liver. And then
mm,
we learned function and we learned science, and we're like, oh no, there's really 8 functional segments. And the
yeah.
prostate's such a great example of this, because we have these anatomical lobes that essentially mean nothing. And then we have these lobules and these zones,
Mhm,
periurethral zones, where we're able to see more and more cancers, where we know higher incidences of issues occur, or like benign prostatic hyperplasia, where people have a growth of too much tissue. And so
Mm.
for me, in 3 dimensions, being able to like pull out not only that prostate, but then to be able to show you where those lobes are, where their boundaries are. Let's cut into it and see it. That for me, I've always struggled with the 2 dimensional images to try and really show them. Like lobes is such a 3 dimensional concept.
Yeah.
And it's so important because one of the earlier techniques that you learn in medical school is some of the urogenital examination. So it does include prostate exams, it does include testicular exams. So if
Mhm.
I can create like a really great mental image for you,
Yeah.
I know that when you're then with that patient, you are genuinely like seeing the same picture I kind of built for you. And so then you can say, well, okay, I know what normal is supposed to look and feel like. Is
Mhm.
that what I'm seeing in this patient? So I think that's incredibly powerful. I think for me, the other thing as well, it comes down to if you're a student, you may be learning and anatomy in generally one of two ways. We have the regional way, which is great, but you end up with an arm in a box, right? Or
Mhm.
a heart in a box. And then it never really connects to anything else, right? Like you're
Mhm.
good with heart and great vessels, but then I'll mention the abdominal aorta and people are just like, well, how is something in the abdomen related to the heart? And it's like, oh, okay,
Mm.
yeah, we didn't tie it all together again. Or we have systemic anatomy where we'll learn the cardiovascular system, the musculoskeletal system. And one of the hardest things is to tie all those concepts back again because patients don't have a problem with just a region or just a system. They tend to have all these relationship issues. And so for me, being able to work in 3 dimensions and to be able to use the model to essentially follow up some of these things. So, like we think about the testes, right? The testes is an external genitaliar structure that
Mhm.
started off on the posterior abdominal wall and traveled through the anterior abdominal wall. And so, because of that, the ductus deferens itself, which is the structure that runs and takes sperm from the testes up to be used in the genital system and the reproductive system,
Mhm.
takes a very convoluted path. And it takes a
Okay.
convoluted path that would cross, if we were looking regionally,
I
crosses
see.
from external genitalia, anterior abdominal wall, and then back into kind of our subperitoneal region of the pelvis. And
Mhm.
so, trying to explain that to someone, if I've taught you those 3 separate pieces in 3 separate lectures, tying
Mhm.
it back together again is awful. Whereas then I can say at the end, like, okay, and here's our overview, here's our recap,
Yeah.
or here's your study material, your independent study material, and now we're following it along, right? And we're
Mhm.
able to kind of track that the number of times there's a nerve, there is a vessel of some kind that is supplying a whole bunch of areas that are very important. And I just have to be like, trust me, they do.
Mhm.
Whereas,
Yeah.
with a really good model that I can set, so it's not just a model that is like, here's this whole thing, go and look at it, because the structures that a student at say UMass Chan Medical School needs to know versus the structures that my learners in the School of Optometry at MCPHS need to know, those are not the same levels. And so
Yeah.
I gave each one the same tool. I would be doing a disservice to one set of those learners. And so for me, I
Absolutely.
think being able to tie all that together is so powerful for me.
Yeah, absolutely. I completely agree with you, Dr. Carter. But thank you so much for this discussion. I think our time
Fun.
is actually come up to an end now, but I've absolutely loved talking to you about all of this. And thank you so much to every single person who has joined us on the live stream today. Hopefully, you were able to gain something from it. If you have any questions at all, because I would love to answer your questions, and I'm sure Dr. Carter would as well, please feel free to reach out to us on our social media platforms. Thank you so much for Complete Anatomy for allowing us to have this discussion today. And happy November, everybody. Thanks for
Happy
joining
November.
us.
Thanks for having us.
Bye.